Okay, so I can divide the things that Impact Project is covering into three things, really. We're talking HIV, youth-led, and displaced communities, right? And as we know, HIV is a global public health issue, and the WHO has recorded that about 44 million lives have been lost due to HIV so far, and Nigeria records about 2 million diagnosed HIV patients currently as of 2025. So now, and this HIV, the deaths recorded due to HIV have been attributed to reduced knowledge, which has, of course, consequently led to increase in transmission. We've also seen increased stigma amidst people that have been diagnosed with HIV, or even stigma towards testing for HIV. Okay? And another thing that has been recorded is reduced access to health facilities or services, which is quite more rampant in Nigeria. And this statistic is even worse in displaced communities. Because number one, they are displaced, they are going to a place they've never been to before. They have reduced financial capabilities and they have reduced health services around that area, which is why the Impact projects decided to focus on this displaced group of people, internally displaced people in Nigeria, because of their peculiarities. They have been shown to have increased stigma, they have been shown to have reduced access to health facilities. And also a lot of health projects do not reach them as compared to the general populace. So Impact is bridging this gap by trying to reduce the transmission of HIV amongst them and those that have HIV to promote linkage to care. Okay, that's actually quite a fascinating question, because that was one of the first things we had to catch on, or we had to approach, because initially we attempted entering into the community. But then there's this barrier you face, because we are not one of them, right? So first we have to partner with an organization, which is Slum and Riot Initiative, that has carried out projects in this displaced community before. So they had access to them, we partnered with them to enter the community. And another thing to note is that's why Impact Project is focusing on youth-led, that is peer-to-peer communication. Because one thing that these people know that we don't know what is happening with them. So we are training their peers to train them, to teach them, so as to promote harmony and relatability amongst them. All right, so the design of the project is to train youth champions, youth HIV champions. That is, we're focusing on adolescents and young adults, because about 40%, Nigeria has recorded about 40% of new cases of HIV in Nigeria are amongst people aged 15 to 25, which is quite an alarming, statistics. So the project targets youth, adolescents, and young adults, and we are training 20 of them in order to ensure that this message that we're bringing, this information that we're bringing, is sustained beyond the period of the project. So we started by training the HIV champions on prevention of HIV, demystifying HIV, right? And then we also expose them on how to manage stigma around HIV and how to link others to care. We talked about HIV self-testing and pre-exposure prophylaxis. So these champions were trained on these things. Then after that, we developed what we call information materials for the outreaches. Right? Because like I said earlier, they know what is going on with them. They know the information they have. They know how best to educate their peers. Okay, so we worked together with HIV experts, the HIV champions and HIV experts. We created information materials, first in English, then translated to Hausa, so that's the local language in that area. And then we also ensured that the messages were in simple and clear terms for those that are not as literate as others. So the project started in August last year, and we rounded up at the first week of April this year. Right? Started with ethical approval, then entering into the community like I've discussed earlier. We held 4 outreaches, which was led by the HIV champions, and of course some of our representatives went with them. And within those 4 outreaches, we were able to reach almost 6,000 people, as 5,600 youths. And these HIV champions did this themselves. And another thing we noted was increased confidence, because in the first outreach, we had lower numbers of reach but over time they became more confident and were able to reach more people. And one thing I think it's a good thing to note is that a lot of these people were actually looking forward to have self-testing kits, to have access to pre-exposure prophylaxis, which was beyond the scope of this project, but we hope to expand more into with more funding. Okay, so we'd love to bridge this gap by providing the self-testing kits and pre-exposure prophylaxis available to these people, easily accessible to these youth, right? So we seek for funding, right, to support scaling up of this project. And beyond that, we'd like to reach more IDP camps. In fact, our goal is to reach about 5 IDP camps by the end of 2027 and reach 10,000 youths. And we'd also love to, in order to further enhance linkage to care, to digitalize these reminders and then follow-up visits for these people. So, Impact Project is seeking funding from you. If you're interested in impacting the life of these young youths that are already in constrained environments and to make life just a little bit better for them. Thank you.